got a 4-year-old patient with a fractured arm, so I'm going to give him a head-to-toe assessment and give medications. First thing I'm going to do is get my doctor's orders and check those over. Then I'm going to gather all of my supplies that I'll need, including medications and anything to take, vitals. Then I'm going to wash my hands and come in the door. So I'll stop at the door, I'll knock, I'll let them know I'm coming in, and then I'll introduce myself. I'm Heather, I'm going to be your nurse. I'm going to go ahead and just look little Max over here. We're going to check to make sure there's nothing besides his arm wrong. We're just going to check him out, and then I'm going to give him some medications for his pain. Okay? Do you have any questions about that? Okay. Hi Max, how are you doing? You okay? All right. Can I look at your other arm and look at your wristband? Okay. I know I just said it, but can you tell me what your name is? He's going to tell me, his name is Maximus. All right. Do you know when your birthday is? No? Okay. Mom and Dad, can you tell me what day is his birthday? Okay, and they told me it's September 28th of 2014. And while I'm here, I can actually just kind of look at the IV site and check it for phlebitis and not inflammation. Infiltration. Good word. And it looks good, looks patent, it's dripping. We've got D5 with half NS with 20 milliequivalents of potassium chloride. And it's running at maintenance. So go ahead and do that. Right, now I'm going to go ahead and wash my hands and put on some gloves. And while I was talking to him and the parents, I did my general assessment. He looks good, he's a little pale, he's a little agitated, looks like he's in pain, but overall he looks healthy and well taken care of. So other than the fracture in the arm, he looks pretty good. I'm actually going to come around on the other side because I don't want to hurt his fracture at all. I'm going to try and stay away from that. This fake IV fell out, so we're going to put it back in. Okay. All right. So I'm going to start with some vital signs. And I'll go ahead and I'm going to check his eyes first. Okay, Max, I'm just going to shine this in your eye. Okay, just look straight forward at me, all right? Okay, there we go. All right, can you look at my finger? All right, good job. All right, so his pupils are equal and reactive to light and accommodation. All right, now I'm just going to go ahead. Actually, I'm going to finish my vitals. So we're going to take his pulse rate. It's strong on that arm. I'm going to take an apical pulse rate. Take that for 1 minute, and his range should be 90 to 110. I would expect that to be a little bit on the high side of normal, if not a little bit higher than that because of the pain and the break. Okay. And while I'm here, I'm just going to go ahead and listen to his heart sounds. We're going to listen to apical and pulmonic. Herbs. And tricuspid, and then the mitral. Okay, they all sound good. I'm not hearing any murmurs like that. Okay, so then I'm going to go ahead and take his blood pressure. And because he's got an IV on this arm, he's got a break on that arm, I am actually going to take it down here on his leg. And I would expect it, or normal is, say, 90 to 110 over 60 to 75. And I would expect that one also to be a little bit high because of the pain. All right, now I'm going to go ahead and I would count his respirations. And I do that for 30 seconds, and his respiration should be 20 to 25, and again, I would expect that to be probably 25, maybe a little bit higher because of the fracture and the stress of it all. Okay, so we got sounds, respirations. Okay, also while I'm here, I'm going to go ahead and just try and listen to his breath sounds so I can be basically done with the stethoscope. And okay, go ahead and take a deep breath in, out, in, out. And as I'm going through this, there is a possible 10 on the front, 4 on each side, and 10 on the back that I could listen to. But I want to make sure that I'm listening to at least each lobe on the sides, and then on the back. On this one, I would, just try and kind of set him up, probably get mom's help to kind of prop him, and so we're not moving his arm, and then I would go ahead and listen to you on the back. Okay. Now I'm going to go. Basically going to start the head to toe assessment. Let's start. I'm going to kind of look at his head and look around and tell him, make sure that I don't feel anything else that's out of place because this was a trauma and he is coming into me in the ER. Can you move your mouth or your tongue on your teeth? That feel okay? All right, good job. Okay, I'm just going to kind of push down. Just let me know if anything feels if it hurts, okay? And because I haven't auscultated the stomach yet, I'm gonna kind of avoid that for now. I'm gonna go down. Okay, and I'm not gonna touch his right arm because, we've already done an x-ray, we know there's a fracture there. Okay, I'm just gonna go down. As I'm doing this, I am gonna check my gloves for blood. Okay, I'm going to go ahead and just kind of check your pulses. And the pulses are strong and regular. I'm going to do turgor. We're going to do cap refill. That's under 3 seconds. Cap refill, and it's under 3 seconds. And his skin is warm and dry. Again, a little bit on the pale side, but other than that, he looks pretty good. I'm gonna go ahead and down here. Actually, while I'm up here, can you squeeze my hands, my fingers? All right, it's diminished on the right side. Can you push? Okay, he says that hurts on the right side. He's just fine on the left side. Okay, can you push up on my hands? All right, push down on my hands. Okay, and those are normal. I'm going to go ahead and check pedal pulses. And those are strong and regular. Check cap refill. And that's under 3 seconds, so we're good there. And I'm going to check for edema. Not seeing any edema. Good. Little bit of edema on the right side, but that's to be expected with the break. Go ahead and his O2 sats, normal would be 98, 99. It might be a little bit low because, if he's anyway, if he's breathing fast, he might not be getting as much O2, so it'd probably be mid to low 90s. Let's see, breath sounds, heart sounds, vital signs. Okay, and he's done everything I've asked. He's, he was able to tell me who he was. So his Glasgow coma is 15. He's oriented ×3. He's a little anxious and he's acting like he's in pain. He's still acting fine. So yeah, it's like a normal little 4-year-old who's had a break. So his psychosocial is pretty good, pretty average. Now we're gonna do mouth sounds. Okay, so first I'm gonna go ahead and I'm just gonna pull this up and look at your tummy, okay? And I would just look and make sure it's symmetric, make sure there's no bruising, make sure everything looks good, and it does. So then I'm gonna go ahead and I'm gonna listen to all 4 quadrants. And to ascertain, before I say that they're there or not, or that they're not there, I would have to listen for 5 minutes in each quadrant. But we'd go through all 4, and he's got normal bowel sounds that are there. Okay, so then I would go ahead and palpate. Okay, and just let me know if anything hurts, all right? Okay, and then I would ask Mom and Dad, when was the last time that he had a bowel movement? And I would ask him if it's normal, if it was normal, what color it was, the amount. And then I would ask him, and his stomach was soft and not tender. There was no guarding on palpation. I would ask them about the last time he urinated and what color it was, if it was normal amount, if everything was normal. And I could also double check that because we're monitoring his eyes and nose. So I could look and see that his urine is clear, pale yellow, of an adequate amount. It's nothing too serious. So, see, we've checked the IV site and it's still good. Everything's still flowing. So everything looks good. So okay, now I'm gonna go ahead and I'm gonna give you some medicine, all right? I'm gonna give him the Tylenol, and we're gonna do that in a suppository form. So I'm gonna let Mom and Dad know with this, and then I'm going to give him a shot of a painkiller. And painkiller is nalbuphine. We're gonna give him 0.19 milliliters. And I would give that in the vastus lateralis, and then 285 milligrams, so 1 suppository of Tylenol. And I would check that I've got the right patient, and the right route, the right dose, the right time, the right med, and then the right documentation afterwards. And in order to do this, I'm gonna actually have Mom come over here, and I would roll him onto his left side, and I would have Mom kind of hold on to him. So we're gonna roll him, try and keep that arm stable. Roll him towards Mom, and I would have her hold him and keep him calm while I'm putting the suppository in. All right, then we go ahead and roll him back down. So there's the suppository. And I actually just realized that I drew this up wrong, so I am going to redraw it. This is why we double check medications. So I'm going to do 0.19. ahead, I don't know how well you'll be able to see that, so I've got 0.19 milliliters. So, I'm gonna go ahead, do this, then I would put it in as vastus lateralis. Squeeze that up, get as quick as we can, get that out, sharps it. And that would take care of the medication. Then I'm going to go ahead and at this point I would ask them if they have any other questions and answer those. Again, I'm going to let them know that the Tylenol can cause anxiety and a headache. However, we also gave in the nalbuphine, which can cause sedation and respiratory depression. So if he gets a little anxious, it's normal. However, the other one should probably cancel it out. But watch his breathing. If his breathing gets too slow, if it doesn't look normal, you know, let us know. We'll also have it monitored on the O2 saturation on the machines, which will also let us know. But if anything looks funny, just come get us. And then with his broken arm, we're going to want to keep it elevated and on and ice 20 minutes on, 20 minutes off. The elevated above the heart is going to help with the swelling, and then after they've casted it, do not put anything down there to itch it. Don't let him put anything down there to itch it because it could break the skin and then he could have an infection. And then he'd be right back here. But if you do notice any swelling or his hand becomes blue or cold on that side below the cast, you need to get right back in because something's going on with his blood vessels and we need to get the cast fixed, fix the cast and adjust it. So, and then again, I would ask them if they had any questions and answer any questions, and then I would go ahead and deglove, wash my hands, and provide for patient safety, provide for patient comfort, and go about my business. And I would document everything.